Good to have you back. Let's bring you this now. Cancer patients are bearing the brunt of last year's fire at Charlotte Maxeke Hospital in Johannesburg. Even before that, the COVID-19 pandemic. Of course, the Cancer Alliance acknowledges and says waiting lists and backlogs have now been an issue for years. It's calling on government to address the cancer treatment crisis. So let's get more insight on this from Cancer Alliance Chairperson Greeff. Thank you so much for joining us, and good morning to you. Let's start with the number of cancer patients, if you do have that data at hand, who are affected by this backlog. Where does that number range at this point?
Well, the number that we currently have is between 2,000 and 3,000 people at Charlotte Maxeke only. These are mostly patients that have been waiting for more than a year plus. And we're speaking here only of radiation services. Now, as you know, that radiation services should actually be done quite speedily after diagnosis, to ensure that cancer doesn't spread and that the patient gets the optimal benefit from these services. So the patients that have been on the waiting list, prognosis have been seriously compromised because they have been denied access to care. And that to us is the human rights issue that is at play here.
What's the threat to the system, Linda, should this backlog continue to grow?
Well, if the backlog continues to grow as it has been doing now, we are going to just see more people dying and not having any equity in terms of access. So our big concern now is, how is this crisis being managed? And as you will remember, we had a march in November to the MEC in Gauteng's office. We handed over a memorandum, and in that memorandum, we asked for a task team to be formed. From that date onwards, we have been in touch with the department on a weekly basis, and the task team was only formed in March of this year. So we've had about 4 meetings, which are every 2 weeks, and we are trying to keep them accountable. But I cannot tell you how much red tape, lack of performance, lack of accountability we have been experiencing. It's just like everybody talks, they acknowledge the crisis now at least. But the action required to really address this in a speedy crisis mode has not been delivering. And it's for that very reason that we are thinking about actually taking this matter to court due to the human rights violations that we are experiencing for so many patients in Gauteng.
And that's understandable. So I can only assume then that even with your engagement with the task team and the pace with which they're moving to address all these issues, there's still no commitment to a date and a timeline as to when the concerns you have raised as a Cancer Alliance would be addressed.
Yeah, and I think, the concerns, just to highlight those for you. First of all, there's the backlog in refurbishing radiation equipment. And procuring enough radiation equipment to serve the needs in the Gauteng province, which is a big province if you think of the areas that feed into Gauteng, and especially Charlotte Maxeke for treatment. The fact that those machines have been not been maintained properly, and that the machines that have become derelict have not been replaced. And the one treatment area that we're extremely worried about is the brachytherapy of cervical cancer and prostate cancer patients. Now, both those diagnostic groups are highly treatable, and these patients could actually live long, productive lives if they were treated timeously. But those patients are also now in the position of not being able. Then the second crisis, not other than the radiation crisis, is the lack of staff. Trained oncologists, trained therapy radiographers, trained physicists that can safely manage radiation equipment. The time to replace vacant positions takes years. And why is that? Why is the National Department and Provincial Departments of Health HR policy so rigid that they can't even make a plan to appoint urgent staff to manage the throughput of cancer patients? And thirdly, the other crisis is the procurement of new equipment. The procurement process is a years-long process. And when you're in a crisis, you cannot have procurement practices that are so antiquated, that it doesn't meet the needs of the community.
Yeah, and you're absolutely right in some of the concerns you raised there. I had a conversation just yesterday with the ad hoc committee on health chairperson, Dr. Rebecca, who was telling me about, their stakeholder engagement, with the stakeholders and suppliers, raising those concerns to say they're also struggling to ensure that they can, of course, have a smooth working relationship with the health department. But going back to your point around, the vacancies being filled for long, Linda, again, the head of Department of Health, only now being appointed by the Premier, David Makhura, that announcement being made only in April. So that definitely is a concern. But did you have an opportunity to write to the HOD? She has big shoes to fill and a lot of work to catch up with within the department.
Yeah, we have been in contact, and the HOD has now been invited to the task team also to get first-hand knowledge. Because, every decision that goes to her has to be on a submission, and it has to have a certain format. There is no crisis avenue that really gives us easy access to crisis situations. And then we hear in the media all the other problems in the state hospital and health sector in Gauteng, with the lack of basic things like food, hygiene in the hospital. So the whole hospital system is broken. And it's not just cancer, it's really on all levels of service delivery.
Yeah.
So, what more must happen before a real intervention is done, and where, really at a national level, this is being addressed.
Just before I let you go, cancer patients that you have engaged with, spoken to, how are they doing at this time, especially knowing that the help that needs to be afforded to them, needs to be made available to them, is not?
Well, I think this is one of the problems. We get daily calls from patients, and also some of our members of the 30 cancer NGOs that we represent have daily calls from patients crying out for help, saying that they've been to the hospital, that they couldn't get an appointment, or when they got there, they couldn't be seen. They waited in a waiting list. They had to go back home, come back again. Those patients don't even have money to get there in the first place. So, it's the crisis is much deeper in terms of the human impact it has, and is actually exacerbated by poverty and the whole system of how people access specialized healthcare.
Well, I appreciate you speaking to us about this morning and highlighting this issue for us. Linda Greeff, Chairperson of the Cancer Alliance, also mentioning there that they are pursuing legal action to, of course, expedite the process with which cancer patients may be assisted with. Well, we leave it